Hi, I'm Nic Brown, pain specialist physiotherapist, and welcome to my YouTube channel. Today I want to talk about something that many people with chronic pain experience, flare-ups. These are times when pain and possibly other symptoms increase, which are unpleasant, it can feel scary and often overwhelming. I'll walk you through some ways to approach these times and discuss when to seek further support. So the first thing I always say is not to panic, or this is easier said than done. Flare-ups are a common and normal experience, and you've likely been here before. Remembering that pain is usually not a sign that anything serious is happening, it can be useful to ask what may have led to this. So if there has been an injury of some kind, then we could be talking about allowing time for soft tissues to heal. But if not, maybe you have taken on too much. Maybe you've not been able to do the things that you usually do to keep well. Or there may have been a number of stressful events that have triggered or wound up the amount of pain that you experience. Flare-ups can also occur during or following an illness, certain life events, even if they are positive. Possibly even the time of year, the weather, or overdoing it. If there isn't an obvious trigger, I always ask myself, what is my body trying to tell me? And then can we find ways to calm things down? So saying to yourself, I've been through this before, I know it gets better, or I can handle this. If you notice that your body is tensing up, can you take some slow, deep breaths and just checking in with yourself? That can help reduce stress in the body. You can head to the relaxation and mindfulness playlist on this YouTube channel for some more ideas around this. Finding a balance between activity and rest can also be helpful. You may need to rest more than normal, but try not to completely stop if you can. Some light activity can help reduce stiffness and pain. And this isn't about forcing anything or making things feel worse. Try and work within what we call your window of tolerance, and that's an amount that you can do fairly consistently. So thinking more little and often than one big effort. Gentle movement can help a lot of people, but you may need to experiment with what's right, for you. This could be a mix of some specific stretches for the area or areas where you feel pain, or maybe some more general global movements like walking, swimming, or even just moving around in the water. You may need to pace activities out more, planning in more frequent changes in position, perhaps doing less over the course of the day, or with some more recovery time built in. Being in a flare-up is also a key time for self-care, so doing the things which can soothe your nervous system, like listening to music, taking a relaxing bath, doing a hobby activity, or being around supportive people, and maybe just pausing in your day to ask what you need in that moment. Take a look at a previous talk on self-care for more details here. You may need to ask for help more, perhaps delegate certain tasks, or just say no at times, and there's no shame in this. Remember that flare-ups are challenging, but by staying calm, caring for your body and reassuring yourself you can get through it. You're not alone, and just taking one step at a time if it feels overwhelming. They will usually settle over a period of days, maybe a couple of weeks, and you will have to build back up to the amount that you usually are able to do. If you're struggling though, if it's having an impact on your mental well-being, the things that usually work, are not helping this time, or you're worried or concerned in any way, then do reach out for further support from a healthcare professional. So thank you for listening today. Remember to subscribe to the page to keep up to date with the latest releases, or share with someone you think needs to hear this today. Bye for now.